Hey guys, it's Bear. It's Wednesday, June 10th. It's 24 hours since I got home from the hospital with my top surgery. And so I wanted to take a minute to just say hi to the world and go just tell you a little bit about my experience yesterday. It's a little bit hard to take a deep breath just because it hurts a little bit at the incisions. So yeah, yesterday got to the hospital at 6 a.m. scheduled for surgery for 7:30, and the hospital they were all great. I was in the OR at 7:30. I mean, we ran right on time. I had brought some things with me to kind of occupy any downtime while I was waiting, and I didn't need any of it. We barely waited at all to get into the prep area. And then as soon as I got in there, it was like go go go. They got all my blood pressure and weight and height and everything. Had multiple people come in and double check on all my health history. Very very thorough, very very polite experience over at Lutheran General. The one exception was just that I had a little snag with the gender that was on my registration form. I asked them to change it from female to male because it does say male on my license. And the registration person said she was going to go ahead and do that, and there was still a couple of things that said female on them, and it's like, nobody was misgendering me. They all knew what I was there for. So screw it. And then, that lady, my one complaint about any of the staff was that lady also, thought it was just completely cool to ask me what my birth name was, which, I don't like being asked. And if you have any experience with trans people, we don't like being asked that. But that was the only thing. Everybody else was so cool. And, just treated me, very professionally, very politely. Nobody acted like weirded out. They all know what you're there for, and like I said, they were just very, very quick, about everything. They got me in, everything done right on time. There's very little downtime between, getting there and getting prepped. Afterwards was, obviously very disorienting. I came out of the anesthesia kind of fighting. They were kind of trying to move me and hold me down and stuff, and I was trying to fight them, so I kind of woke up to like, hey, stop fighting me, Bear. Stop fighting. And then I went into a really bad episode of the shakes. I don't know, if it was affected the anesthesia or coming out of it and being a little freaked out or what, but I had a really bad episode of the shakes, and I think they actually gave me something to calm that down. And they move you from phase 1 of just sort of waking up and being really messed up into phase 2 of recovery, where I was sitting in an armchair and just kind of dozing in and out and trying to come down from the nausea of the anesthesia. I don't know how many people go through that, but I get really nauseous from pain meds and anesthesia and stuff. So it was just a matter of, eating some crackers and drinking ginger ale and just kind of waiting it out. They also put a patch behind my ear for the nausea. I guess it's something that you get when you go on like a cruise ship. And yeah, so that was the hospital. It was a really good experience with them, thanks to everybody over at Lutheran General. And so yeah, now I'm home, just trying to stay comfortable. I've got, pretty heavy duty bandaging on. I can feel that there's a really thick pad underneath this ACE bandage. And then, they put in these drains, and those are stitched in under both of my armpits. Those are kind of uncomfortable. I'm getting like a little shooting, stabbing pains where those are sewn in. And where they're under my skin, I can feel it, so that's a little uncomfortable. and now I can feel the incisions too, and those hurt, and everything itches now. So it's kind of a combination of pain and itching. But I knew that was coming. It can't be a painless procedure. So I'm just trying to take it easy, trying to remember it's okay to ask for help. So that's hard for me, and trying to remember not to raise my arms above my shoulders. Learning how to do things. Like if I've got my elbow on a surface, I can use my arm, but if I don't, it's actually really difficult. And then just trying to, sorry, I think I'm saying a lot. I'm kind of messed up right now. Just trying to, take it easy, and make sure I've got food in me so that I can take pain meds without vomiting, and just kind of settling into this routine of eat, pain meds, sleep, repeat. So yeah, I just wanted to give you guys that update, that I'm doing good. I'm hurting. My whole chest feels bruised in general, even up here, feels really bruised and tender. But I'm doing okay. And I wanted to say thank you to everybody that's been touching base with me, and asking how I'm doing. All in all, this is perfectly normal, and I'm feeling good, So, again, thanks a lot, guys, and, I'll touch base again later in the week and let you know how I'm doing.